Hello and welcome to the Ilene Silverman Show. I'm your host Ilene, and on this week's program, our guests discuss the Clear Passage approach, a non-surgical manual physical therapy with a high success rate for treating female infertility. Stay with us, we'll be right back. Welcome back. Thanks for joining us for our program. Clear Passage is a network of physical therapy clinics specializing in hands-on treatment of adhesions, female infertility, and other specific problems. To tell us more, I'm pleased to introduce our guests, Belinda and Larry Wearn, founders of Clear Passage Clinics. And Belinda and Larry, it is wonderful to have you here.
Thank you for having us here.
Well, we're so very proud that right here in Gainesville is your first and home office of Clear Passage Clinics.
That's
and
right.
Of course, you're longtime residents of our community. And we are good friends from many years back. So this is a special privilege for me to be able to talk about all the very valuable things that you're doing.
Thank you.
Yeah, thanks for having us.
Oh, certainly. And to help us understand, Belinda, well, first of all, how many years have you been married?
28
This is a
years
test.
now.
Okay, you passed.
You got it right now.
I've only known her since she's been 2 months old, so
Okay, there's some good history.
we've been together a long time.
Oh, I like that. I like that. And what about your degree as a physical therapist? Sort of give us a little of your background, Belinda.
Well, I graduated from University of Florida. I'm a Gator, 1975.
Yeah.
And I moved up to the DC area and was working at Georgetown University Hospital, and then ended up moving back and running back into Larry when I was 30 and he was 33. And a few years after that, in 1984, I developed cervical cancer.
Okay, the turning point in your life, a grim turning point.
Yeah, and my
something
career.
Scary.
Yeah. So my job, summer of '84, was going to Shands 5 days a week for 8 weeks. I got 40 external radiation therapy treatments, and that shrank the tumor by half. So I had to have 2 internal radium implants 2 weeks apart, where they put radium pellets in a stainless steel tube implanted in the uterus, and I had to lie still in a lead-lined room for 72 hours each time. So over the next year and a half, it killed the cancer, but threw me into menopause, so I couldn't have kids. And I became a chronic pain patient. I had all sorts of pain symptoms, so I wasn't able to work.
Right, you had frozen pelvis, you were, tell us some of those ailments. It just scares me.
Well, yeah, I developed what's called a frozen pelvis, where all of the organs were adhered and stuck together. So I had intestinal problems, pain with sitting, pain with intercourse, low back pain, and I saw many different specialists, and I got really tired of hearing it's all in your head.
Yes, I know.
Or you have to learn to live with it. So that started Larry and me searching for alternative, any kind of technique that sounded like it might help with complex pain.
Right. and to give you a quality of life that you were anticipating, especially so young.
Yeah,
so
definitely.
how did you, okay, so let us follow this, and you take us along, Larry. How did you start to develop what is called the Wearn technique, or if I'm jumping ahead, give us some background.
No, you're fine. We were desperate. I mean, I knew the prince marries the princess and they ride happily into the sunset. And it
my expectations.
Wasn't working that way.
Yeah.
So Belinda started taking a lot of physical therapy courses with manual physical therapy with different modalities just to see if there was anything that could help deal with adhesions. Eventually, I mean, I love her dearly, and I got tired of seeing her in pain.
Yeah.
So I started taking some of the courses too. When she'd come home and we'd come home, we would develop techniques that we would use on her, and she started getting better.
Wow.
Our whole focus was on pulling apart and freeing
and
up
explaining adhesions, just so we understand.
Adhesions are internal scars.
Okay.
Anytime you heal from anything, you scrape your knee, you get a scar on the outside. If you have a surgery or, God forbid, radiation therapy or endometriosis, you heal on the inside. The scarring forms. Once you've healed, that scarring remains inside of you, and it's there in you for life. They've been measured up to 2,000 pounds a square inch. Surgeons have a hard time cutting them.
Oh my gosh!
So they
that's
didn't want to do
was
surgery.
All filled in you. That's
yeah.
Okay.
Mm-hmm.
Oh no, surgery, that's scary, and you had enough.
Yeah.
So you suddenly saw something's happening, something good.
We saw something's happening. A year later, Belinda was doing well, and she decided she didn't want to go back to just exercising people and doing hot packs and ultrasound.
Mm-hmm.
Yeah. So I felt really good and was ready to go back to work, and there wasn't really a clinic in town that would let me do, hands-on work for almost an hour at a time. So we opened our very first private practice back in December of 1989.
Okay.
And within the first year of treating complex chronic pain patients, we had a workers' comp patient that we were treating for head, neck, and back pain come in and tell us that she was pregnant.
Wow, and you said, okay, we've got to look into this. We're going to take a quick break. Stay with us, we'll be right back. We're back discussing the Clear Passage approach, and I'm pleased to introduce Dr. Richard King, Medical Director, Clear Passage Clinics. And thanks for joining us, Rich.
Ilene, thank you for having me.
Oh, it is my pleasure. I am learning so much. And let us know how, first of all, you're former Chief of Staff, North Florida Regional Medical Center,
yes.
Gynecologist, surgeon, many years of practice here in our community. As you said, you've had the mother, the grandmother, the children, whole families
yes.
coming to you
Over
along the way.
40-year period of time.
Right. It's a compliment. It is. And how did you get to know Larry and Belinda and turn a corner to be a part of Clear Passage?
In approximately 1990, I got a call from Larry, and he said, Rich, I've been working on some people with manual physical therapy, and they said they had become pregnant. And he had asked them, and they said, we were told we could never get pregnant because we had blocked fallopian tubes. So we think we may be on to something. Being a surgeon and being skeptical, I know with my own hands it's very difficult to open blocked fallopian tubes. But I got to talk to the patients, I got to look at their histories and review their charts, and there's a dye test called a hysterosalpingogram, and you inject dye through the uterus into the tubes, and it showed both tubes were blocked. And then after this clear passage therapy, you could see that there was a free spill of dye. So I very quickly became a big fan of Larry and Belinda, to the point that I wanted women to have another option, which I think is very important in life. And because I didn't want to be considered biased because I was being paid, I've donated my time since 1990 to get the word out to women. There are approximately 4 million infertile women in the United States. So treating infertility is a huge benefit.
Right. And that is quite a compliment, really, what you said to Larry, to Belinda, certainly, and to all the women that are receiving the good results from Clear Passage approach. And tell us more about, well, you just mentioned the enormous amount of females with infertility. What all does that cover, Belinda? And Dr. King, kind of tell us what that means. We've seen blocked fallopian tubes. What are some of the other difficulties a woman would have?
Well, some have high FSH level, which is follicle stimulating hormone, and that's the hormone that tells the ovary to release an egg. And as a woman gets older, it takes more and more of that FSH to get the ovary to release an egg. We've treated some women with unexplained infertility. Their tubes are open, their hormone levels are fine, their husband's sperm counts and levels are fine. I'm sure Dr. King can mention some others.
And what are some of the others?
Also endometriosis. Approximately 11% of women have endometriosis, but statistically they feel it's 20 to 65% of these women become infertile. And endometriosis is where the lining of the uterus gets outside the uterus, inside the abdominal cavity on the ovaries and fallopian tubes, and makes a woman infertile.
Right.
Also, you have a condition called polycystic ovary disease, and that's a thick ovary with multiple cysts, and they have irregular periods. They don't ovulate well. And the
well, and I can see, even from my point of view too, and what you were saying, that a lot of these are age-related.
Correct.
And women are putting off getting pregnant.
True.
Then they start to try, and they're already, a little bit older, got married later in life, had a career, and that just increases anxiety. That's not a good, a good partner anyway. And so a lot of this, your method, helps women who are right on that fringe of age, the 40-year-olds.
No, that's true. This approach actually works better in women 40 years of age and above. It works for all infertile women. We've had a study, which you're going to touch on later, that's recently come about that shows that we can effectively treat the 6 different types of infertility that women have.
Excellent. And we're just going to take another break and come back and talk about that study. Stay with us. We'll be right back. We're discussing the clear passage approach with Dr. Richard King and Larry Wearn. And Larry, thanks for rejoining us. And Rich, you were talking about the study that is really extraordinary, a 10-year study that you have conducted over almost 1,400 patients. So, Larry, kind of give us an overview of that.
We started realizing that we were having success in so many different areas and so many different types of infertility that we hired a double PhD out of the University of Florida, Dr. Amanda Rice, and she went through our patients for a 10-year period to see what kind of success rates we were having with PCOS, the polycystic ovarian syndrome, and endometriosis and blocked tubes. Frankly, we were surprised to find that we had treated almost 1,400 women, and the results were just fairly spectacular.
Yes, yes.
Yeah.
And this study, I know, has been published.
Yes.
In a specific journal or more.
Alternative Therapies in Health and Medicine, June of 2015.
Okay. And from your medical point of view, help us understand some more of this study and the results, because when you see these graphs, you can see, wow, just what you're saying. This approach is working.
Well, what makes this study so significant is the number of patients. There were 1,392 patients. And in several categories, we equaled, if not surpassed, medicine and surgery. I'll give you some examples. With blocked fallopian tubes, we were able, with manual physical therapy, specifically the Wearn technique, to open blocked fallopian tubes in 61% of the cases. In surgery, the best they can do is 57%, and another article was 40%. You can see that in the graphs. But then when you come to people that had gotten pregnant, having had blocked fallopian tubes and coming to us, there's a 57% success rate. And the surgical success rate runs from 22% to 37%. So there's a huge difference there.
Yes, yes.
And then in endometriosis, where the lining of the uterus gets outside the uterus, inside the abdominal cavity, we equal the success with both surgery and medicine without the risk of surgery and or medicine.
Wow, so that's phenomenal and so encouraging for women out there who are facing this problem, maybe facing the problem, because I don't know anybody who signs up. I know you were a surgeon. I don't know anybody who signs up for surgery willingly or the drugs and what is involved in, say, in vitro fertilization, what a woman has to go through. Maybe more than once. And the clear passage approach has longevity to it also.
Yes, it does. What we think we're doing is actually separating adhesions or pulling them apart rather than tearing them or cutting them, because we have long-term success. Several of our patients have had 2 children. Others have had 3 children. When you look at in vitro fertilization, where you take an egg and a sperm, they're fertilized and then put inside the uterus, if they have the Wearn technique before they undergo in vitro fertilization, there's a 56% chance of their becoming pregnant, where in vitro fertilization by itself is 37% success rate. So that's a 50% increase.
Oh my gosh.
And even more interesting, in women above age 40, there's a 3 to 5-fold increase. So we have a higher success rate with those particular age group.
So that is extremely significant, because we talked about the age-related and the way women these days sort of wait a little longer in life to become pregnant and then are faced with this difficulty. Sure. You know, when you talk about the adhesions and pulling it apart, I think about Belinda and, you know, how she explains that process, which sounds one way and I know is quite involved.
It is quite involved. And you know, the thing is, Ilene, we were never interested in or never thought about helping infertility or opening blocked fallopian tubes or improving hormonal levels. I was only interested in helping my wife have a life, you know, and a life without pain. We just didn't realize at that time how common adhesions were, that they form anywhere in the body, and So that's
Wow.
where we went on.
Thank you both. And Dr. Richard King, thank you for all you're doing for Clear Passage and so many other people. We appreciate you. And stay with us. We'll be right back. We're back talking about the Clear Passage approach with Belinda and Larry Wearn. And I'm glad you've rejoined us, Belinda. And there's so much good knowledge. And Larry, the clinics are treating other conditions. And you've got so many good stories out there.
That's right. You know, you can read our stories. We have a book called Overcome Pain and Infertility Naturally. You can get it at Amazon if you like. There are probably 80 individual patient stories written by our patients, just that we're so shocked that they had success, and great stories of people searching for relief. But one of the most remarkable ones lately sort of does introduce the fact that adhesions happen everywhere. Singer from California called us up and said, you know, I read about you opening blocked fallopian tubes, I read the studies, can you open larger tubes? I've had bowel obstructions. I've had 6 surgeries for bowel obstructions.
It's just scary.
They're all life-threatening. You can't eat. The only thing they can do for it is surgery. My last surgery was 12 weeks ago, and they're scheduling my 7th surgery. They're killing me. I can't eat or drink. Yeah. So she came in, and we said we don't know, but we'll certainly try. We treated her, and she canceled her surgery. She started eating normally, and has not had a surgery now. It's going on 8 years.
Oh my gosh.
So we have just published our first abstracts and some studies, and addressed 15,000 gastroenterologists up in Washington, D.C. from around the world. So it's just, adhesions seem to form everywhere.
Right. And you gave this woman her life back.
We did.
Yeah, a quality of life.
We did.
Absolutely.
Which, looking through that book, you have brought joy to the women who'd had the infertility problems, to allow them to have families, and now this. And we're going to do another show about all the many other things, including treating chronic pain, like that you were, Belinda was living with, because there are people out there who deal with this who want to know what they can do.
Definitely.
And they can find you on the website, right?
Oh, absolutely. Yeah, our website is clearpassage.com.
Okay.
And if people go to our website and call our main office in Gainesville here,
right.
I'm happy to schedule a free 30-minute phone consult after they fill out just a very brief one-page medical history form. So I have a little bit of their history, and I can answer specific questions and let them know if I think that the work that we do, if we feel that they're appropriate and that we feel we can help them.
Yes, and you are reaching out all over the country. many clinics that you've been able to open up. I know that that takes a lot. You put a lot of training into the physical therapists who join you.
Yeah, I wrote a 550-page therapist training manual, and we put together a clinical internship training program. So we've trained therapists, and we have clinics from Great Britain, East Coast, and central, the central part of the country, and we're expanding to the West Coast soon.
Exceptional. Even you mentioned somebody finding you from Australia and saying, "No, I'm coming here."
I talked to a woman yesterday, and I assumed she wanted to go to one of our British clinics, and she said, "No, I want to come to Gainesville, where you are." So that was exciting.
We just had a PhD.
Yeah.
He did his own film afterwards. He flew here from New Caledonia. He lives on a boat off of Australia. He said, "I'm going to die if I have a bowel obstruction." And he flew here 20-some hours. We treated him. He was so thrilled with the results. He did a film that's on the website. We've treated about 300 or 400 bowel obstruction patients now, so we're preparing a larger study.
Yes, you should. I mean, I'm sure that you never realized all those many years ago where this would lead you. As you said, turning a very negative into a positive for many other people. It's
absolutely
just a corner you didn't expect.
When I graduated from PT school, I never had a clue that we would be treating women with infertility, people with complex chronic pain, people with bowel obstructions, and other issues as well. Adhesions cause many, many kinds of different problems in different areas of the body.
And being able to make a difference in people's lives, to help them with a healthy lifestyle. I mean, what do we value the most? Being healthy.
That's right.
It's so incredibly rewarding.
I can see that.
We'd love to retire, but we just can't put it down. We wonder what's going to happen next.
What's that?
You've got a lot more ground to cover. Okay. And I thank you, Larry and Belinda. Thank you so much, and I value our many years of friendship. All the good things you're doing, and Dr. King also.
Yeah, thank you for having us, Ilene.
My pleasure. And I'm so glad that you tuned in, and I hope you'll join us next week. Take care.